The COVID-19 pandemic has brought joint responses of health cadres, including nurses, doctors, medical laboratory specialists, radiographer, nutritionist, dietetic technicians of catering services in hospitals, cleaners and at the hospitals, administrative staff. All are part of the healthcare teams who provide valuable contribution to the provision of healthcare to all. With us live on telephone call is Mr. Khalid bin Mohammed bin Abdullah Al-Sawafi, Director of Ibra Hospital. Mr. Khalid, good evening, and thank you for joining us at Oman Television.
Good evening, Mr. Abdullah. Thank you very much. Thank you.
Thank you for your time. As the Director of Ibra Hospital, how have you prepared the hospital for COVID-19?
Oh, yes. Thank you very much. First, I would like to send through Oman TV a thank you note to our brave heroes who are in the front lines in the hospital, our all categories of healthcare workers, whom they left their families and their kids just to help our patients and to help our community.
Indeed.
I would say to them, thank you very much. Thank you for all the things that you do, and thank you for being so compassionate, and I'm very grateful and proud of you all. Also, I would like to give a lot of thanks to all members in the Higher Committee, and many thanks go to His Excellency the Minister of Health and their excellencies and their secretaries for their commitment and support and encouragement. And above all, our grateful and thankful. We are grateful and thankful really to His Majesty for his encouragement and his support. To answer your question, Mr. Abdullah, as hospital director, we started very early as we heard about the pandemic hitting China at that time. We coordinated a communication line with the ministry and with the Directorate General of Health Services in the Governorate in North Sharqiya. Then we developed an internal committee led by the hospital director, and we decided through that committee to make awareness, not only for the hospital staff, but even our social responsibility asked us to go even outside the hospital. So before the school closed and the university, we started to go to schools, some of the schools in North Sharqiya and universities and mosques also. And we start with our staff to give them a lot of awarenesses about the pandemic. And we trained our healthcare workers about infection control policies and the updated guidelines about the COVID-19 management. Also, we developed one policy about the hospital plan for COVID-19. This is only specifically only for COVID-19 management, including all the flow charts and the instructions regarding patients' flow. Also, we started to control the patients' flow because we don't want crowd and to spread the infection in the hospital. So we postponed some regular and non-urgent appointments and the elective surgeries as well. We start to also create new spaces. For example, we created one ward with 28 beds in the hospital, including 8 beds only for ICU or critical care. And also we divided our emergency department into 2 departments, where one department is only for the COVID-19 patient or for the suspected cases, and the other department is only for the normal emergency department, and the staff are not mixing together.
Right.
Also, we have a lot of plans and management supply and personal equipment.
Wonderful. Wonderful. Then, Mr. Khalid, it looks like you're well prepared. So everything is going well there and smoothly, isn't it?
Yes, alhamdulillah.
Yes. Now, in this particular case, these healthcare workers that you have talked to them, they look strong and resilient in the face of the unknown. They inspire us as they go to work every day at a great personal risk to keep others safe. Now, to lower the risk of the healthcare workers from this contagious virus, what action they have taken?
Yeah, really many, if not all of our healthcare staff have decided to socially isolate themselves from family and others. And also, some of them have isolated themselves even within their own homes. This is all is done to prevent the possibility of transmission of this virus. Just imagine, Mr. Abdullah, the psychological, not only the physiological stress that on the healthcare workers. I really salute them for this, for their work.
Indeed, indeed, we all salute them here at Oman Television, and the whole public, I'm sure they salute them very much due to their dedicated work. They're very much dedicated to their work. Now, finally, would you like to convey a special message to the public?
As I used to say, that this is not the responsibility not the responsibility of Ministry of Health. Responsibility always can be transferred, but the accountability is shared. And for that reason, I urge myself and everyone to adhere strictly to social distancing instruction used by the, or which is advised by the higher committee, and also for home isolation, washing the hands, and please to everybody that to follow the healthy habits when coughing and sneezing. By following these instructions, we will prevent ourselves and community from spreading this infection.
Indeed, we need to work hard to follow all precautionary measures. Thank you very much for being with us, Mr. Khalid. That was Mr. Khalid bin Mohammed bin Abdullah Al-Sawafi, Director of Ibra Hospital. Remember, you need to break the chain to make the change. Follow all precautionary measures. Stay at home, safe and healthy.